My answer for that is situational. Okay, I can't give you an example. I could give you an answer based on the label or package insert, but really there are practical matters that come into that all the clinicians listening to this are going to know. How often dressings are changed are really dictated by exudate, the amount of exudate. Okay. In our standard practice, we actually change dressings Monday, Wednesday, and Friday. Okay, that's our standard practice. We do have clinicians that change dressings less than that. Remember, LipoGel basically biodegrades over time, and it's going to last certainly longer than a week. Okay, we change dressings Monday, Wednesday, Friday from a safety perspective. We don't like to have wounds go. If we don't have to, we don't like wounds to go for a full week without somebody looking at the wound bed to make sure that something didn't turn against us, the wound didn't all of a sudden severely regress. I mean, that's just kind of part of our prudence as clinicians. We don't like things to go too long without somebody making sure, things haven't really turned on us. Now, there are exceptions to that. Again, we do have clinicians that change them less than 3 times a week, okay, because they certainly can deliver what they deliver longer than that. Another exception is a Pro-4 wrap or a wound that's in a wrap. Typically those wraps stay on for a week, and there's no problem with LipoGel and the appropriate secondary dressing being on for that full week's time. The key is to choose the correct secondary dressing, and that would be true regardless of whether LipoGel was there or not. Basically, we need secondary dressing. It's going to manage that exudate. If we don't have a secondary dressing, and the exudate is just way too high, well, then we're just going to have to change the wrap more frequently. But again, that doesn't have anything to do with LipoGel. The point in describing that is there's nothing wrong with it going for a full week, okay? Now, there are other clinicians from a safety standpoint, at least when we're talking about wraps, do things a little bit differently. And their position is they'll change wraps twice a week, okay? They do that from a safety standpoint so that if a patient misses a visit, an office visit, which happens in real life, then that patient's never more than 1 week away from getting that wrap changed. If they only did it weekly and a patient missed a visit, now they're out 2 weeks, okay, which no clinician likes for a wrap to be on for 2 weeks. So, from a technology standpoint, can it go for a week? Sure, okay, and we do that for wraps, okay, and it's fine. Our personal preference standpoint, where we're not limited by a wrap, we do Monday, Wednesday, Friday, for the reasons I expressed.